Welcome to Hospice Explained. This podcast is intended as an educational aid and is only a resource to begin to understand the end-of-life season. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek advice from your physician or qualified members of your healthcare team with any questions regarding a medical condition.
Hello and welcome to Hospice Explained. I'm your host, Marie Betcher. I'm a registered nurse. I'm a former hospice nurse, and this is my podcast to educate patients and families regarding hospice and the end-of-life season. This is just one of my short episodes, and when your loved one is in the hospital and a provider approaches you and says that they would like you to consider comfort measures, I just want to give you the definition of comfort measures. It's when curative care ceases, so they stop curative care. They focus on relieving discomfort, pain, and distress for patients nearing end of life. It's often started during a hospital stay with appropriate medications and bedside care. Comfort measures are not a full care program. They do not include the additional layers of support that the majority of patients and families need during this end of life season. But in reality, it's better than nothing. It's much better when it's time for the end of life that it's accepted and a patient is given as much opportunity for peace and comfort. The hospice team has more to offer, but sometimes hospice is not offered. It's not available for insurance, for location. There could be many different reasons. So I just want to encourage you that if your loved one has been offered comfort measures, please understand that this is the hospital's way of taking care of them the best they can. And feel free to participate as able. Usually you can stay at the bedside. Make sure your loved one is not anxious or short of breath, and make sure you let the staff know their symptoms if you are spending that time at the bedside. The hospital staff should be limiting their movement of the patient. Yes, they still need to be turned and positioned for comfort and safety, but maybe they're not taking them all the way to CAT scan and, transporting them all over the hospital for treatments or for diagnosing problems. They're staying in their room. There's limited interruptions. It could be just lighting, music, sound, everything could be more soothing. They don't poke. They try to medicate with the path of least resistance. They try not to disturb the patient, and they try to do their best. I highly encourage you to consider comfort measures if they've been offered. Often the staff is telling you that they don't know what else to do to cure your loved one. It's hard, and the one part where hospice can really help is the nurse, chaplain, and social worker in hospice are all trained and have experienced this many, many times, and they can help patients and families through that. So if you're able, hospice can often be a better option, but if you're not, comfort measures are a definite option and very useful for caring for your loved one at end of life. Not in every case will the comfort measures be a quick end of life. Sometimes it's just focusing on comfort and best quality for your loved one. And maybe they have a fair amount of time, and palliative is an option. So consider palliative care if they do have more time and are able to go home, if they don't qualify for hospice, for example. If they qualify for hospice, then seek out that option if you're able to get all the support for yourself and your loved one. Thanks for listening to Hospice Explained. If you want to be a guest on Hospice Explained, please email me, marie@hospiceexplained.com. Thank you.
Thank you for joining me on Hospice Explained. Think about ways you can make a difference in someone's life. Also, please subscribe and share this podcast with anyone who would benefit from listening. Thank you.